This video is part of a Medicare 2012 My Experience V-Book series. This book is not an official Medicare publication and is provided in the hope that it may help some people. Every situation is unique, and the information provided here may or may not apply to your situation. This video looks at the cost analysis part of the process. So let's go to the process, and then we'll look at analyze cost. And in particular, in this video, we're going to be looking at the cost of original Medicare and Part C, or Medicare Advantage. What we see here is the list of steps that I walk through in order to analyze cost. And so what we're going to be doing is walking through those, each one of those, while we actually do this online on Medicare.gov. So what instructions here? Instructions here say to start at Medicare Home, and that's what we'll do. This is the home page for Medicare.gov, or Medicare.gov, which is the home page for Medicare. What do we do next? Well, in each of these pages, as we work through, you'll see a red arrow which says what to do, and then a black arrow associated with that showing where on the page to find that. And so here we want to compare drug and health plans, and that should be here on the page. So we'll go over to the Medicare page, and sure enough, here's a compare drug and health plans. We'll click on that, and sure enough, we come up with something. Let's go see where that takes us. We go over here to the next step in the procedure, and this says zip code. Enter the zip code, so let's go do that and then find plan. So I'll enter my zip code here. Then click on find plans. And what you'll see here is that this particular zip code has two different counties associated with it. You may or may not encounter this question, but if you do, just select the county that you're interested in and click continue. Now it says we're at step 4. Let's go over here and see what we have in the next step. It says to click on I don't have any Medicare coverage yet, so let's go over here and do that. And then I don't get any extra help with Medicare. So these are very specialized things. You can look at the others, but for the purposes of this analysis, these are the settings that I use. Then continue to plan results, which we'll do. Now it starts asking about drug plans. Well, for purposes of this analysis, I'm not interested in drugs. I'm going to let it use some average drug cost, and so I'm going to answer no to the drug question. So here's how you do that. I don't want to enter drugs now, and it really wants to make sure you're doing that, so you're going to skip the drug entry. And also, I don't want to add pharmacies now. It lets you add your pharmacies if you want to, so I don't want to add pharmacies, and it's going to nag you again to say no, you really don't want to do that. So skip the pharmacy selection. Okay, so we've done that. Now it says suggests that we refine the research here. Let's go see what that looks like. So suggestion is we do health, and health, here's where this is on the menu here, so let's change health status. And I'm going to, the default here is poor, but I'm going to look at both, default is good. I'm going to look at both excellent and poor as I do this analysis to get a range of costs. So in this case, let's click on excellent, which is what we suggest here. Then for plans, I'm going to look at these, just the Medicare health plans with drug coverage, which is this box here. Now, what this is going to do is take us directly to Medicare Advantage plans, Medicare Type C. So that's why you want to click on that. And then it suggests you do update plan results here, which we'll do. Okay, so now we should be good there. So we've done that. Now let's see what we do next. Next it says continue to plan results, so we'll do that. And this is what you'll see when you do that. Now, if you look at this column here, you'll see, first of all, look at the rows in this table. First of all, there's original Medicare, and so we're going to use that number. That's one of our base numbers. Now, the other thing to look at is we're looking at estimated annual health and drug costs. If you look elsewhere in the book, you can see where that term is defined, but basically what that's trying to do is say, hey, under your conditions at excellent health and so forth, this is what, if you pay, or if you have original Medicare, this is what you would anticipate to pay for a cost. Now, it's not the cost of Medicare. This is the annual estimated total outlay for health and drug costs. So this includes whatever you pay for, if you pay for a Medicare premiums, it includes whatever insurance plan you have in conjunction with Medicare. And then if you look down at the bottom, then it talks about the Medicare Advantage plans with drug coverage. Okay, and I'm going to go ahead. It says that there are 22 plans here, so I'm going to go ahead and click on View 50 of them. It's viewing the top 10. I'm going to do 50 and look at all of them essentially, and the results are sorted by this lowest estimated annual health and drug costs, the same thing we have up here. So we should have low numbers here, and we should have higher numbers as we go down to the bottom of the table. And sure enough, the bottom is $4,650 here, your cost, and the top is or the lowest cost, is $226.50. And the first few, you'll notice, are pretty similar in cost. So $226.50, $2,700, and so forth. And quite a bit under if you just do the original Medicare thing. So that's interesting data, and that's what I use to gather the data for the chart that I'm going to show you in a minute. So I recorded those numbers. I recorded the highs and the lows there. Then the suggestion is we iterate. In this case, I want to look at poor health conditions. So the way you do that is you go up here to refine your. Suggest you go to refine your plan, and then you're back to step 6 up here. So we'll do that. Refine your plan. It says is up here. Sure enough, there it is. Refine your plan results. We'll click on that. And that takes you back to this page. Now let's go on our chart here. Let's go back to 6. And sure enough, here we are on 6. Again, suggestion that we enter our health. In this case, I'm going to choose poor because I want this range of poor to good. So I'm going to click on poor here. And go to plans. We've already checked that. Update plan results, which you need to do to make this all work right. So we do that, and now we're going to continue to plan results, the next step in the process. And now we should have some different numbers. And now we see that Medicare cost is $11,900. And again, we're going to view the 50 here. And these are then the Medicare Advantage plans that are available. And this shows all the plans that are available, again, sorted by annual cost. So I looked at the original Medicare. I looked at the lowest cost Medicare Advantage and at the highest cost Medicare Advantage. Now, these plans are going to differ for you if you don't happen to be in Hamilton County of Ohio, because all these charts in the website are set up based on your location. So remember when we came in, we entered the zip code, and that's how it ended up selecting the results that we have here, or providing those results. So let's go back now to cost analysis and look at what we have there. So here's a spreadsheet that you can, if you click on there, if you're in the web book, you click on there, you'll get a spreadsheet that you can work with. and put your own data in, but here's the data that I gathered. So here is, over here is the original Medicare cost, okay, estimated cost, and these might actually be a little bit different than we saw on the website because the website data changes. So notice this is as of October 27th. I'm shooting this video on, what is it, November the 19th. So the numbers change. Well, you have to deal with that. Didn't change too much, though. And then, again, we have Part C. And here I have a Part C low and a Part C high and excellent health and poor health. Again, Medicare, excellent health, and poor health. And so this is a chart that I'm filling out. Now, Medigap, there's a different process for filling out the Medigap chart. And that's, if you go to this page here and you go to the Medigap thing, you'll see a similar thing. Again, you just walk through the part thing just like we did for original and Part C. But the real interesting thing we ended up doing is plotting all of this on a chart, and this is what the chart looks like. So there's an excellent part of the chart and a poorer part of the chart. And these are the various costs that you see. So here, this is Medicare Advantage low and high, Medicare Advantage low and high, original Medicare, excellent health, poor health, and then the Medigap policies will come in there. So that's how I did the cost analysis. You might want to do the same kind of thing in order to figure out your Medicare options. This is the home page for Medicare 2012 My Experience. On the home page, you will find links to the web book, ebook, hard copy book, and various V-books that are available.